everyone. This is Rosalee Henry, your seven-figure doula whisperer, and I'm so happy that you take the time to join us for another conversation where we transform lives one conversation at a time. And tonight, I am excited like I'm always have, but more excited tonight because I have my personal doctor, Dr. Dana Wilson, on with us. And Dr. Dana Wilson is a nurse practicing and a board-certified family nurse practitioner with over 26 years of healthcare experience. Dr. Wilson is a proud owner of Wilson Wellness Clinical Care, a family care clinic right here in Stone Mountain, Georgia, and she specializes in sexual health, medical weight management, and preventative care. With a passion for research and advocacy, she also works on studies addressing hypertension, long-term COVID, and kidney diseases with risk factors, which primarily pay the Black community. Dr. Wilson is not only a leader in her field, but also a dedicated wife, a mother, and grandmother, and she's also committed to educating and uplifting her community. So I'm so excited to have you, Dr. Wilson. Thank you for taking the time to be here. And also have with me Mr. Bizzell, my partner in crime, as always. Thank you, sir, for being here.
That's my job. That's my job, to make sure everything runs correctly. Thank you for coming, Dr. Wilson. We greatly appreciate it. And yes, she is my personal doctor also. I give her a hard time, but she tries to keep me healthy.
Thank you guys for having me.
Yes. So, Dr. Wilson, what inspired you to choose healthcare as your career path?
Well, as a young girl, I always wanted to do healthcare, but it was with animals at first. So I wanted to be a veterinarian. But as I matured, I was like, you know what, I don't want to deal with animals. Maybe I'll deal with people. Mm-hmm. And just seeing the health effects in my family, in my community, pushed me towards leaning more towards caring for humans.
For humans. Well, I'm glad you switched from animals to humans, so I'll be able to meet you. So.
Yes. And so that drew my passion. And then also witnessing firsthand the health disparities that our community suffers from was a push to make sure that, we stay in the know of what's going on in healthcare.
Well, thank you so much for that, because we need more healthcare providers like you. So let's start with heart disease. And that's something that often goes overlooked when we talk about, especially in women's health.
Yes.
Right? So how common is heart disease in women today?
So heart disease is very common in women, especially African-American women. Mm-hmm. And we have a lot of risk factors that comes along with heart disease. Most times we deal with high blood pressure. We also deal with high cholesterol levels. A lot of women suffer from obesity. So it's very prevalent in women.
What would you say are the biggest risk factors for heart disease in women?
The number one is hypertension. I've come across a lot of young women, actually between the ages of 30 and 50, that have high blood pressure.
Wow.
We just tend to not care for self, caring for others.
Everybody else except ourselves.
Correct.
So what would you say would be one of the good preventions for that? I mean, other than the common sense when cutting back on the salt, what would be something else that people could actually look into and actually start doing to improve their, one, blood pressure, two, losing the weight? Because I know food and everything else has something to do with it.
Correct. So for women, and being a female myself, self-care. I would start with self-care. Start looking at yourself. It's okay to be selfish. You have to care for self before you can care for anyone else. Because if you're not healthy, then it won't benefit the care of others.
Put the oxygen mask on first, right?
Correct, like on the airplane.
Yeah. Well, I know, for a lot of us women being in the menopause stage, right? So now we're talking about all the additional everyday stress that we are going through, taking care of kids, running a business for us who are entrepreneurs, or even for the ones who are actually going to work, it's very stressful. But on top of that, now you have menopause to deal with.
Right.
So how would you say that link to heart health, or are you seeing a link with women going through menopause that is somehow now linked to, like the heart diseases that's popping up?
Yeah, so when a woman goes through menopause, it means that she starts to lose her hormones, her menses stop. And so in that incidence, estrogen and progesterone levels decrease. Estrogen is responsible for cardioprotect. It protects the women from heart disease. So when they start to lose their hormones, it just increases the risk of heart disease. And so it also, when a woman goes through menopause, you also see blood pressure elevation. You also see cholesterol elevating. You see weight gain, a lot of muscle wasting. So it's a lot of things that happen with going through menopause.
So you hear.
I'm going to say this, and I know that I, as a guy, might get in trouble, but I do it anyway. That's my job. I'm always in trouble.
You have your doctor here.
Yeah, I know. From a guy's standpoint, we understand that menopause is real because we have to live with it today, and the threats to our lives and everything else. My question is, what can we do to help it, though, other than
be more patient?
No, we ain't talking about all that. What can we do, or what could we recommend for a woman to do to try to help get that balance back? I mean, I know of some things, but you being the medical professional, what would you recommend?
Well, first, try to understand her, because she don't understand what's going on with her. She just know that she's feeling crazy, right?
Okay, I'm glad you said that word, because that's what I was about to say.
She just know that she's feeling crazy, right? She has all these feelings, all these different things happening to her, and she's like, what's going on with my body?
Right.
And now the spouse is irritating her.
Right? We ain't trying to. We just trying to be us, and y'all. Okay, keep going.
Yeah. So first, recognizing the symptoms, understanding, what she may be going through, and then seeking care. Get those hormones checked.
So as far as the
Go ahead. No, go ahead.
Oh, as far as the hormones are concerned, is it recommended that? Is there like a food or a drug or something that could be done to try to help get those back in balance?
Well, first you want to know what your levels are, so you know where to start, and then there are some things that you can do, like to alleviate the hot flashes, like black cohosh. There's some other herbs. That's just one that I'm familiar with, and then there's also some prescription medications that you can take. But you first have to understand what the levels are.
So before you say anything else, I know we talk about women health and women going to menopause, but what do you have for the guys? Because I know they go through things too. We're not the
They go through andropause.
They go
andropause. So what they experience.
Right. So
yes.
What are your suggestions for them, and how do we as women help them while we're going through our own stuff too?
So basically the same. Guys, get your testosterone levels checked, especially if you're experiencing, weight gain. Guys go through emotional roller coasters as well. They experience cholesterol levels. They may, I don't know if I can say this. They may experience decrease in libido or not having their morning erections anymore. And that's usually when they come in, when they're not able to sustain or have an erection.
Okay. So it's important that men acknowledge what they're going through, how they're feeling, and reach out to their doctor and get your blood work done, see where you are, and then take it to the next step. Right. So for me, like saying now the next step, I know that you do the Bout, and that's something that Darren and I have done also. We know it works. We can swear by it. Can you, or are you okay with talking
about Bout?
And what it is and how it works and the benefit of
the hormone therapy.
Yeah.
So Bout is a hormone replacement therapy that I do, and basically you would come in for an assessment, and we check your levels to see where your levels are, and according to your levels determines your dosage. Men get testosterone only, And women can get testosterone and or estrogen just depending on if they still have their uterus.
Right.
If you have your uterus, you would get estrogen, and then you also get progesterone. So it just all depends on levels. And so the benefits of boosting your hormones is those symptoms that you're feeling with menopause and andropause, they go away.
Okay.
They go away. So a lot of times the women come in, irritability, insomnia, hot flashes is one of the main ones, night sweats, decrease in sex drive,
Lack of energy.
Brain fog, inability to retain anything.
Right.
They come in with those symptoms, and those are common symptoms of menopause. And so once we optimize her hormones, then those symptoms tend to go away. It may not occur on the first
Right.
round, but if you continue optimizing your hormones, and along with taking supplements that enhance the pellets, they're called pellets,
Right.
then you'll benefit from hormone replacement therapy.
Okay. So for people who have no idea as how this is administered, can you give us like a breakdown as how the pellets are
Or administered.
uh,
Okay. So the pellets are administered through a small incision. I call it like a paper cut, right underneath the skin. There's no sutures required. We just put steri-strips and apply a clear and a gauze dressing. And the area is numb first.
Right.
we don't make the incision without numbing the area, so
Right.
it's very comfortable. And it's no pain. You really don't know it's there unless you touch it. And you keep that dressing on for about 5 days for my women, 7 days for my men, and then it comes off. Just gives the skin time to heal over. And then the pellets work by cardio dependency. So the more your heart pumps, then it releases. But it keeps you at a constant level.
Okay. So this is not something that you're going to have to forget to take it
Correct.
today or take it tomorrow.
Correct.
And it gradually dissolve in your body. And like you said,
Correct.
your heart pumps, so it just releases
It
what
releases.
you need.
Correct.
What you need.
Correct.
So for women, how often do you suggest that women get theirs, and how often does men get theirs?
So most times women get pellet every 3 to 4 months, but it just depends on when your symptoms return.
Okay.
So we don't treat numbers, we treat symptoms. So even if your numbers are in the range of where we like it, which is usually 150 to 250 testosterone, if you're still symptomatic, we may still have to boost you because you're not at that. We call it a sweet spot. But usually every 3 to 4 months, and men every 5 to 6.
Okay. So listeners, if you're interested, Dr. Wilson, can you tell your audience where you're located and how they can find you so you can help? And after you finish, I would like to hear like at least one success stories outside of me and Mr. Bizel, because we're here.
Yes.
I mean, we can tell our own success story, but the one other that you can share with someone who you help and really see the result.
Okay.
in it.
All right. So the name of the clinic is Wilson's Wellness Clinical Care, and we're located at 1310 Rockbridge Road, Suite F, and that's in Stone Mountain, Georgia, 30087. And our telephone number is 770-864-5538.
Okay. So do you have like one person that sticked out to you other than me? Because I can tell mine. But when I came to you, I was having migraines. I was having hot flashes. I was about to kill Mr. Bizel.
And I told her, please don't kill him.
I was brain fog because
Yes.
I had COVID,
Yes.
and my brain fog was like really, really bad.
Yes.
But I know for sure with everything that he helped me with, I have to say thank you, because my migraine, I still have. Also, you give me the pack of the Imitrek with 9, and I still have maybe 3 or 4 on one strip.
Wow.
from 9 and
Wow.
about a year ago. So
Wow.
that says a lot.
Wow.
So
Wow.
I can't thank you enough for that. So,
Wow.
Mr. Bizzle, you want to chime in and see?
I'll let her
We don't-
tell her story
Okay.
first.
All right. Well,
Yeah, so I'll actually speak for myself because I'm also a recipient of hormone replacement therapies. So my symptoms were fatigue, low libido, brain fog, memory loss. I couldn't retain anything. I can have a conversation and couldn't tell you what was
just
said in the conversation. And so I decided to go ahead and get pelleted after realized that it was something that really worked. And after I got pelleted, I was able to drive 8 hours without getting tired. Usually felt like I was running a marathon and wasn't running anything. I was just trying to stay alive. Memory loss was gone. The retention was back, and I was like, oh, I got my life back again. My libido increased. And that's my story. It really changed my life. It really did. So if you're having these symptoms, reach out to someone that is practicing hormone replacement therapy.
Because I was just irritable, man. I was mad for no reason.
For no reason. Just irritable all the time. It's like, why are you looking at it? Why are you looking at me? Don't look at me. Don't talk to me.
Walking around with my shield on every day.
Yeah, for real. So, for us female, just doing so much, running a business, caring for the family, and to even, at times we put ourselves last.
We do.
Right? And it's a lot. It's a lot. So that moment when I stepped out and I'm going to be selfish. I'm going to start taking care of me.
Correct.
It paid off. I felt better. Migraines were I would say gone.
Right.
Right. My skin was glowing.
Yes.
I had more energy.
Yes.
I wasn't as irritable. And anything else you want to have?
She was a more pleasant person.
Oh, you were going to say I was a more loving person?
Well, that too, but I was trying to keep, we got to find out what the rating for this station is.
We said loving, that's all.
Okay,
I was more loving.
Loving, we'll put it that way. For me, it just helped with my energy level, and it helped me as far as getting back into balance, because what a lot of men don't understand, I believe, is the fact that testosterone plays a big part in everything. It plays a big part in muscle retention, muscle growth. It plays a big part in your everyday intimate activities. And at certain levels, you can actually start going backwards. I learned that over time after dealing with Dr. Wilson. But when you get those levels back, even in your 40s and 50s, once you get those levels to where they need to be, you actually start feeling younger, stronger. You're able to build muscle again. You're able to participate in those intimate acts for the times that you want. Plus, even with us being men, the brain fog, the ability to retain things, the ability to learn new things, all of that comes into play. So yeah, it's something that I think a lot of guys need to look into. It's something that you also have to remember. You see these commercials online about the other companies that have these pills at, what is that? Health food store. I've forgotten the name of it. But what they don't tell you is that they're animal-based. What we're talking about is human-based hormone replacement, so you don't have the side effects or after effects that you can have from the animal hormones. And that's something else a lot of people really need to talk about and look into.
And I'm going to add to that, Darren, the pellets are plant-based, so they're organic. So there's less side effects than the synthetic hormones, which have been around for a while. So that's what makes it a better choice.
Okay.
But the synthetics are still available for those who want. But we like Bout.
Definitely, because I'd rather go all natural with something than to have to deal with horse hormones and wherever else they're getting this stuff from.
Right, and the pellets last longer.
Right.
So you're not having to apply
a
gel
every 30
or put
days.
a patch on or get injection.
On a regular basis.
On a regular basis. It's almost like a get it, put it and forget it.
Yeah, like a crock pot, a crock pot, set it and forget it. Yeah, and the thing is that, we're in a time now where not everything we're going to be able to get or to afford naturally. So the things that we can do, let's do, because we only have one body.
Yeah.
So, we only have one body. We only have this one chance to take care of ourselves and just do it right. So whatever we can go natural, do natural, do it. And then the things that we have no choice or control over, then we just don't. But the things that we do have control over, put it into our bodies, please, treat our body. It is the one. The temple of God is the one.
Right. So I wanted to add to the benefits of the hormone replacement therapy, the BioT. It also has great cardiovascular benefits. Studies have shown that it helped to lower cholesterol, and I'm a witness to that because it helped to lower my cholesterol. It also helps with weight loss. It helps with I had a brain fart. It also helps with migraines.
Night sweats.
It helps with night sweats. It helps with fibromyalgia. A lot of women deal with fibromyalgia, and some men do as well. And so when they receive the pellets, it's like, wow, my pain is gone.
Wow.
So it's a lot of different benefits to hormone replacement therapy.
Yep. Well, on that note, we're going to take a quick break, and then we're going to come back, and then we're going to talk about childbirth and women health.
Okay.
Thanks for staying with us. We appreciate you listening on. And again, we have Dr. Wilson here with us. Now we're going to be talking about childbirth and women's health. Hey, that's what we do, right?
Yes.
Bring life to the earth. So we have to discuss that. So, Dr. Wilson, how would you say that pregnancy affects a woman's heart?
Well, when a woman becomes pregnant, of course, her heart rate increases, so the blood volume increases.
Pumping for 2 now, right?
Yes, pumping for 2 now.
Or 3.
Or 3.
Or more.
So it can go from 10 to 20 extra beats per minute, which increases the volume of the blood circulating through the body, which can stress the body. And so if the woman already has issues, then it can complicate her pregnancy.
Wow. So are there any specific conditions women should be aware of during pregnancy?
During pregnancy, heart failure is one of the complications that occur with pregnancy, usually during the third trimester.
Wow.
Or up to 5 months after a woman delivers.
Well, I am so glad that you said 5 months after, because as a postpartum doula, I know a lot of time people hear about doulas and they only think about birth. And there's so much emphasis on birth and nothing much on postpartum care. So for you to say even 5 months later, that can still affect women.
Correct.
It's just like women give birth, they go home, they go back to the doctor maybe 1 week later, and then it's like for months before they even go back and see, and then there's no checkup, nothing. And that's the reason why I'm such an advocate for postpartum awareness, postpartum preparedness, because we have to stop sitting back and think that somebody's coming to save us. We have to know, prepare to save ourselves. So how do you prepare for this period of time that you're going to be home with a newborn, and if you're not trained, you don't even know the symptoms to look for.
Correct.
If you're feeling sick or feeling tired, you might think that, okay, it's because I just gave baby. So I have a baby, I'm not going to lay down. And it could be something very serious, detrimental.
Correct.
I got a question. Yes, I'm a guy talking about pregnancy. Y'all going to have to just get over it.
That's okay.
What I've been wondering recently is during pregnancy, all the things, the body changes and everything that a woman goes through, how is it that just now it's become a big issue with heart conditions or women that have other health fallouts, and doctors are just ignoring it, especially in the black household? Why is that so prevalent now? I mean, why have we not been talking about this before now? Like, I mean, I don't know anybody specifically, but I've seen the news reports of women that are maybe in their last trimester. Now all of a sudden their heart rates are through the roof, or blood clots, or difficulties with the delivery, the umbilical cord, or the baby's having distress. Why has that not been addressed before now, or why haven't other procedures been put in place to, I don't know, alleviate, or what the proper word is, to make sure that these things are not taking place anymore?
I can answer that
Go
on
ahead.
on the non-medical side, and then I'll have the doctor answer that on the medical side. So for me, I think the awareness is more brought about now because of social media, and more celebrities and more affluent people are experiencing the same thing that non-celebrity and non-affluent people have been experiencing over the years. So, but now because the social media is now brought to light, how we can fix that is more education. We have to be prepared to talk more about it, normalize it,
Okay.
and let it know that this is happening across the board. This is not just happening, or this should not be now, shown or talk about, or more awareness be brought to it now because of more affluent people is being affected. So I'll let Dr. Wilson finish off with that.
And yes, Rosalie, I can concur with what you're saying. The awareness
Yes.
is there, so people are paying more attention. People are speaking loudly now about it, because it's not just happening to the normal person.
Right.
Celebrities are experiencing it as well. And women just making sure that they're going to their prenatal visits. Making sure that they are speaking loudly when something is going on with them. Say, hey, doc, I need you to listen to me. This is what's going on. But me, don't just disregard, my symptoms or my feelings. And just being an advocate for themselves,
Right.
as well as their families. You gotta keep pushing that button, until somebody listens. But I think it's the awareness now that's is more prevalent, and so people are starting to listen.
Yes.
But there's still some gaps. Some people
A
still
lot.
fall
Yeah, there's a big
through the
gap.
gaps. So just making sure you go into your visits, making sure
Right.
that if something is going on, that you go see about it. Don't just brush it off. And then being an advocate for yourself.
Right.
Okay.
Right.
Okay.
And as for me, being a postpartum educator, that's one of the things that I push. I want to make sure that the people I'm talking to, the families I'm serving, they are aware of what is going on with their body. They're aware that they have the right to speak up for themselves.
Correct.
I allow them, and I encourage them to advocate. Use your voice.
Use your voice.
You may walk in with this perfect birth plan, and a doctor in a white coat walk in and everything goes over because, no, this is your birth plan.
Right.
And as long as it's nothing that's going to detriment, going to hurt you
Right.
or your baby,
Right.
you should be able to have a say in how you're feeling and the things that you want, your birth,
Right.
your body.
Right. I agree.
So-
Long as nothing is detrimental to, the birth of the baby or the health of the mother.
Exactly.
then yes. Education is key.
Yes.
And that, to me, that should start in the beginning. When a woman first finds out that she's expecting, at every visit, that education piece should be a part of it. So when it comes time for her to deliver, or if things start to happen, then she can, she'll know, hey, something is not right.
Right. And also to make sure that everyone have access to health care,
Correct.
and also have access to doctors who is going to listen to you, and spend the time to explain something if you don't understand. Right now, Georgia is among the highest when it comes to maternity mortality rates.
Correct.
It's just sickening.
It is.
And just to learn that there's so many women that the first time that they see a doctor is when they're giving birth.
Giving
No
birth.
prenatal care.
None.
So all the issues, everything that could have been addressed during pregnancy, now, it becomes an issue because it's just like anything else. It doesn't get treated, now festered, and now it becomes something else.
Correct.
So now,
Right.
and on top of that, this mom is going to go home with a baby that neither she nor the baby had any treatment, anything for the past 9 months, and now going home again with unsupervised help, no, so the stress of now taking home this baby, have sometime maybe the first one, it doesn't matter how many, because you could have 5 and you're a different person.
Correct. Each
Because the way
pregnancy
you
is
are,
different.
every
Yes.
pregnancy is different, and you're in different space.
Right.
Now, you not only have, let's say, it's the 5th child. Now, number 5 is not number 1, where it's just mom and that child. Now it's mom and 4 other siblings.
Correct.
4 other births that she had to deliver,
Correct.
4 other maybe traumas that she had gone through,
Correct.
4 other postpartum period that
Correct.
she had gone through. So it's a lot.
And she may not have any support. She may
And
be
no-
a single mom.
Exactly. And even sometimes they have partners, but sometimes the partner themselves don't
know.
even know what's going on. Or they themselves can be going through things that are, unaddressed.
Correct. And Black women have a high rate
Oh,
of
yes.
readmission after
Yes.
birth because of
Yes.
complications.
Yes. Wow. So what would you say you have experienced? What are the most common postpartum health issues that you've seen that is related to heart disease?
The most common postpartum
Yeah.
issue. So a lot of women now, because they're not healthy going into the pregnancy, they're not healthy. They may have high blood pressure. They may have diabetes. They may have thyroid issues. So going into the pregnancy, they already have issues that can complicate their pregnancy. And then, of course, the increased risk of developing heart disease
Wow.
during the pregnancy.
Then on top of that, now you have preeclampsia
Yes.
and gestational, high blood pressure.
Yes.
Hypertension.
Yes.
Oh my God.
Yes. And with having that, in the long term, it sets them up for developing heart failure just by having gestational hypertension.
What is preeclampsia? I've heard of it, but specifically, what does that mean?
The magnesium level elevates, and it can cause a woman to have seizures. So
And she can die.
And she can die.
So giving birth, she can actually develop seizures.
Correct.
Yes. And you have preeclampsia and you have postclampsia. So even when she get home, these are issues that still can arise. Swelling of the face, swelling of the feet. That's why it's important to, be
High blood pressure.
It's important to be monitored, but also having someone with you who is trained to identify what you're going through. Because, a mom could have a long labor. She could have had, so many bags of fluid. So she may feel like, okay, my legs are swollen or my face is swollen because of the fluid, but it's not always because of the fluid. It could be that she's going through something else that is outside of the fluid intake that she had gotten.
Okay. Like I said, I've heard of it. I've just never known really what it meant or what the symptoms were, just like gestational hypertension. I know that's supposedly happens after or during birth or like the third trimester. But preeclampsia, I've just never really understood what that was.
Yeah, so
And I'm
they
sure a
usually
lot of people
present
out there didn't.
with elevated blood pressure is usually the first symptom, and usually they'll start showing that usually during the third trimester,
Right.
third trimester of pregnancy,
And after birth.
and after birth, so
Post-
they can still
post-eclampsia.
have it after they deliver. But usually, once they deliver, it's supposed to go away, but sometimes it doesn't.
Okay.
And then also, just having the support and the rest, be able to sleep.
Right.
That also, can help, because a lot of times just the stress, doing everything they have to do during the daytime and still not be able to sleep at night. Also, mom maybe want to breastfeed, but, she's unable to, and not having the resource, not having a lactation consultant that she can talk to, not having someone who is going to be able to support her and guide her, that's an additional stress on top of that. And we all know that stress is one of the factors that increase with high blood pressure.
Okay.
So we know that maternal mortality rate is significantly high. So what would you say are most critical steps that a healthcare provider and women can take to reduce the risk during childbirth?
So
I know we kind of touch on some of them.
We did touch on some of them, just making sure that, when she first finds out that she's pregnant, get the care that she needs.
Access to care.
And if there are chronic conditions that are already pre-existing, just to make sure that those pre-existing conditions are under control, keeping her her provider abreast of what changes she may be experiencing, and also the education so she'll know what to report when she's experiencing things that she's never experienced before. So prenatal care is important. And just, being able to identify the symptoms and making sure that any chronic conditions are being addressed.
And I would add to that, making sure that you have a support team, making sure that you have a list of who you're going to be reaching out to for what, just a list of anything that you need, just plan. You don't get pregnant today and have the baby tomorrow. Most time is 9 months. Right? So you have all that time to plan what is going to happen after I have this baby. So just being prepared, being aware of what are the things that you're going to need. Who is my support system? What are they going to be able to help me with? So that will definitely help, because like I always said, that the mortality rate doesn't stop at the birth.
Right.
A lot of times it's after parents get home that things go haywire. And because they have no support team, they don't know who to call, they don't know the signs to look for, they don't know what to expect, and also, even advocating for themselves, because sometimes they may know all that, and then they go to the hospital, and they're telling them, okay, you're not feeling this way. This is not what you're experiencing.
Right.
So that's why it's important to just having someone there with you when you can. I know everyone is not in a position to have someone go with them, but as much as you can, when you can, if you can, have someone go with you. Because sometimes when we're in pain and everything else going on, we can't even advocate for ourselves. But just to have someone there to say, okay, that wasn't what she said, or ask you, do you understand what the person just said?
Right.
Because sometimes we're just in so much pain, we're just like, give me whatever.
Right.
But having someone there to say, hey, remember, this wasn't what you said. Is this not what you want?
Right.
Or, ask a person to explain more to you if you don't understand.
Right.
So just having that, support system, having that awareness, being educated. There's so much information out there. And, for me, on my website, which is mothershelpinghandsatlanta.com, we have so much information. I'm here, as a certified postpartum doula. I'm willing to answer questions because I'm passionate about this and I want to help as much as I can. So if you have any question about the postpartum period, I don't do birth. I'm not a labor doula. I prepare you for the postpartum period because things doesn't end at the birth. Right? The birth is just a small part of it. You bring the baby her side. No, you have this stuff for 18 years at least. Right. So what is your plan for those 18 years? 9 months? 18 years? Mm-hmm. Come on now. We have to do better planning, better educating ourselves, putting our system in place, having a backup plan. Mm-hmm. Same way you plan for the gender reveal, mm-hmm. the baby shower, plan after. Add care. It's like a lot of time people ask for all these things on their registry.
Yes.
Put care on there.
Right.
Have somebody come and clean the house for you.
Right.
Come do some laundry. Make a meal plan.
Right.
Cook a meal for you.
Right.
That's better than how many diapers you're gonna get and all the things that you may not even need. Right. For real though.
Nobody's disagreeing with you.
I'm passionate about that.
Yeah.
I'm not as passionate as because this is something that we've built a business around, something that you've been into a lot, but I do understand more by being in the position that I'm in, by being with you through this journey. I do understand a lot more. And I do understand that women have to learn to speak up for themselves.
Mm-hmm. Healthcare providers need to listen to us.
Well, that's...
Yeah, sometimes we speak up, but we're not heard.
That's something that I don't know if that's ever going to change, simply because
most of you men.
Dr. Wilson and I have had conversations outside of medicine and outside of other things, and then we've had a lot of medical conversations. I think she's an exception to that rule because she does listen.
Yeah.
But a lot of medical professionals, and she can correct me if I'm wrong, once they get that title, they know more, so you should just listen to them. I think that's what's happening. And I could be wrong, but that's the impression that I get. Because they have that medical title, they feel that, okay, you say you have a sore knee. Did you hit a dresser? Okay, that's the reason for your sore knee. And they refuse to go any further to look to see maybe there is something else there. Hitting the dresser may have just irritated it enough to bring it to the surface. Dealing with pregnancies, y'all go through a lot, a whole lot. And they probably just attested to, well, she's pregnant, so she'll get over it. Now,
Well.
Dr. Wilson, you can correct me if I'm wrong. I might just be speaking to be speaking, but I think that's a lot of it. What is your take on it?
That's how you feel, and maybe you have witnessed some of the things that you're speaking on. Again, everybody's different.
Yeah, we have witnessed.
Yeah, we've witnessed it.
Yeah.
Everybody's
Correct.
different. I have heard a lot of patients say that the providers are not listening to me. And you just got to make sure that you're being heard. Make sure that you're being heard. And if you're not, if you feel that you're not receiving the care that you need, then it's by right, find somebody else.
Yep. Find someone who's going to listen
That
to
is your
you.
right.
Oh, no, I'll keep that to myself. Go
Okay.
ahead.
All right, Dr. Wilson, so we're going to switch a little. So burnout. We know burnout is a major, issue in healthcare. What do you do, to maintain
Your sanity.
your sanity and to be present for us, because I know sometimes as a doctor, like for you, with your practice, the reason why, I've been coming to you over the years is I don't feel rushed when I'm with you. You sit and you listen and we can talk. And sometimes, we talk. So it's not like you're only a doctor. Sometimes I feel like you're also a therapist, right?
A lot of people believe that.
Right. So how do you manage?
How do I keep it together?
Yeah, life work balance. How do you handle that?
I make sure that I put God first.
Yes.
Very strong in my faith. I take time out for myself. Every morning, I have about an hour and a half of me time, and in that time, I spend time meditating and spending time in the Word, and so that's what keeps me abreast. It gets me started for my day, and then once a month I go and get a massage.
Yeah.
So it's all about self-care and just preparing my mind for the day, staying strong in my faith and putting God first.
That's awesome, because God knows some days, boy, we face some things.
Yes.
So, yeah.
So that's how I do
yeah.
it.
Yes. Well, yeah. That's good, and I hope that you will continue doing that, because we need you around as long as possible. So, thank you so much for being a wonderful doctor. And a great friend. We can call on you anytime. We have any question, and that's very important. So
Darren know how to use the text.
Yes, I do. You said that I can ask questions, and I do.
To reach me.
Yes. And I know sometimes I probably drive you insane because of the questions that I ask.
Yes. So Dr. Wilson, a big thank you.
Yeah, I will say this too about Dr. Wilson. She has no problems with answering my questions. And that to me is a professional. Yes, I understand that you have a practice. I understand that, you get paid for the services you render. But what we appreciate is the fact that if a question is asked, you will find a moment to answer a basic question.
I do.
You will find a moment to say, no, these two things shouldn't be taken together. Or, yes, if you think this exercise is good, then I'm all for it. It shouldn't hurt anything. I've met a lot of doctors who, even if you have a simple, should I take an aspirin with a Tylenol? I know that may not even be a real thing, but that's just an example. They will have to force you to, well, not force, but they will make you come into the office to pay for a visit, to sit for half an hour just for them to say no. When a simple text message to me would be better. And it also, in my opinion, the way you handle things, you can deal with your patients a lot better because you can talk to them and communicate with them without always having to have an office visit.
Technology.
And, yeah, that's what technology is for. And even I have said to her, why don't you have assistants in your office? And she's
and what I tell you,
bitten my head off. These are my patients. I'm taking care of them. Ain't nobody else going to touch them. And that, to me, is how a doctor should be. Like the old-fashioned doctors you see on television in Westerns. They made house calls. So her type of house call is a text message. And it's a simple thing.
Yeah, and she will check up on you.
Let me not send her my results for a couple of days. I get a text message. Hello, I haven't gotten your results for the day.
Yeah, which is important. It makes you feel, special, and it makes you feel that your doctor is in tune with what's going on, and that's
they care. You're not just a number that they're cycling through the office. They actually know you. She cares about you. She knows you by name. She knows your problems, and she's willing to say, because of what I know about you, don't do this or do this. Right. Instead of just being a doctor that says, well, let me check your charts because I don't know who you are out of the 300 people that come through my office every week anyway.
Well, thank you so much for that, Mr. Bizzell. And also, Dr. Wilson, thank you so much for taking time being here. I know you were patient earlier this afternoon, and we really appreciate you coming in and just sharing your wisdom with the community. I know you're passionate about the community. You're passionate about the people that you serve. So if anyone is looking to switch their doctors or looking for a new doctor,
hey,
Dr. Wilson,
don't occupy all her time.
Yeah, Dr. Wilson, she let you know. And, if you are a good fit, because the same way that, you don't want to work with everyone don't want to work with you. So she have to make sure it's a good fit. So again, check her out, Dr. Wilson. Please repeat your contact information, and wish you all the best from here.
Thank you again. My clinic is Wilson's Wellness Clinical Care, and we're located at 1310 Rockbridge Road, Suite F, in Stone Mountain, Georgia. Our telephone number is 770-864-5538.
Okay. And
people,
also,
hit her up. Check out the pelleting. It works in multiple ways.
Put her number in the chat for me, please, so people can have it. And also, my audience, people who are here in Atlanta, it doesn't matter where you are, because most of our products and services can be done virtually, because I have so much information on my website. But if you are, in the maternal, area, or someone who is needing of any type of service, postpartum care, please let us know. Our website is www.mothershelpinghandsatlanta.com. So that's mothershelpinghandsatlanta.com. We're going to drop it in the chat, and my number is 678-898-4005. That's 678-898-4005. I know not everyone may, can afford to have us come in to help them physically, because that's what we do, but we also can help you virtually. Information is important. We have a lot of information. We have a lot of, things that we can teach you on. We have a lot of courses, lot of classes. So if you cannot afford to pay somebody to physically come in, we can help you virtually. So until next time, this is Rosalee Henry, your 7-figure Doula Whisperer. Thank you. you.